Hello everybody. Today we'll be discussing what to do if your child has a temperature. I think it is always worrying if your child has a temperature. So basically, infection can cause high temperature or fever in children. Now we have to know what is fever. If it is 38 degrees centigrade or 100.4 degree Fahrenheit or above, generally we classify that fever of child. It can vary from child to child, so trust your instinct. You know your little one better than anyone else, isn't it? If you are worried, contact your GP or health visitor or out of our service of NHS 111. Fever is very common in children. Over 60% parents and children aged 6 months to 5 years say that their child have one time fever at least. So how you know if there is a fever of your child? You can see that is flush cheek, feeling sweaty, clammy, feeling hotter than usual when you start touching them, on their forehead, back, or tummy. If you think a child has a fever, use a digital thermometer to check their temperature. If the child is under 5 years old, it is recommended to take their temperature under their armpit rather than ear or mouth. This gives more accurate result. Hold your child on your lap and place the thermometer under the armpit, holding their arm to the side of the body until the reading is ready. Usually it is around 15 seconds. Forehead thermometers are very unreliable and usually not recommended. An underarm temperature of 36.4 is considered normal in babies and children. Any temperature over 38 classified as fever. So what are the cause? That is fever is by infection or other illness. High body temperature is a natural response to fight against the infection. It is very difficult to know whether it is by bacteria or virus. Now, common condition that usually causes fever are respiratory tract infection, flu, ear infection, tonsillitis, kidney, urine infection, common childhood infection like chicken pox, whooping cough, etc. Your child's temperature can also rise after vaccination and overheat because too much bedding or clothing. High temperatures in babies and children associated with some serious condition like meningitis, infection of brain and spinal cord, septicemia, infection of the blood, pneumonia, infection of lungs, groups A strep. It is important to remember serious cause of fever relatively rare, but if you are worried, of course it is better to get medical advice. Now what you can do when child has a fever? A mild fever usually nothing to worry and you can treat at home. NHS recommends to get an urgent appointment with your GP and call 111 if child is 3 months old, temperature is 38 or above, child is 3 to 6 months old, temperature is 39 or higher, and fever lasts for 5 days, and child has other signs like unwell, persistent vomiting, cannot feed, floppy, drowsy, little one crying constantly, cannot console or distract, and cry not like normal cry, high-pitched cry, worried about that your child, that your instinct tells that is something serious. So all this time you can contact. But if very serious illness signs like botchy skin, fast breathing, then take to emergency department. And 999 an ambulance is needed if child stop breathing, not waking up, under 8 weeks old and very worried about them, had feet for the first time, even they seem to be recovering, had spotty purple rash that not disappear when you press with a glass against. That could be meningitis or blood infection, serious infection. So when child has high temperature, sometimes they can get a fit called febrile convulsion. This is because part of the body that regulates the temperature has not fully developed yet. As child gets older, their body will get better at regulating their body temperature and likelihood of febrile seizure will decrease. So that during this time they can become steep, twitch, or lose consciousness. It can be scary, but most of the child fully recover from this. So this is a little bit of a thing we discussed about what to do when child has fever. Hope this will help you to increase your knowledge and increase what to do, increase about awareness what to do. We will discuss with another topic next week. Bye for today.